pandemic became a global health crisis. It has changed the economic, medical, and public health infrastructure. Around the globe, and India in particular, healthcare professionals and researchers from biotechnology and pharma industries are looking for an effective treatment regime. Our country is the worst hit in Asia and surpassed Brazil also. Since there is no effective medical treatment has been found to work with high efficacy, getting people vaccinated is the only long-term solution to the current situation. In this context, we have to mention only about two vaccines from our country. As a nation, we should be very proud of India's self-made vaccine against COVID, that is Covaxin, developed by Bharat Biotech International Limited. They have the expertise of developing many vaccines earlier. But developing in the current situations under pressure and against timelines is not a simple task. This is indigenously developed and manufactured in our country and has the credentials of all kinds of international and scientific organizations. Let us hear about the journey of the making of Covaxin and clear the questions we have about vaccines in general from Dr. Raches Ella. Dr. Pragnya Chigurupati will maneuver the conversation in a way to clear most of our doubts and dilemmas. Besides these, keep all your questions handy towards the end of the talk. Dr. Raches Ella is a medical doctorate in India, completed Master of Science in Clinical Research from Emory University, and a postdoctoral fellow from Johns Hopkins University, where he was trained in vaccine clinical development. He is the project leader for all SARS-CoV-2 vaccine and is involved in the making of Zika, chikungunya, typhoid, rotavirus, and Japanese encephalitis. He is the head of business development and advocacy at Bharat Biotech. He has multiple papers published to his name in reputed science journals. The talk today will be steered by younger generation. Dr. Pragnya Chigurupati is a breast oncoplastic surgeon and a consultant in Hyderabad. She has done a fellowship in breast oncology in Tata Memorial Hospital, Mumbai. She did her MRCS and breast reconstruction training in UK. She will be moderating today's session. The floor is all yours, Raches and Pragnya. Go ahead.
Thank you for having me, Ms. Chigurupati.
Hi everyone, and thank you for having me here. It's pretty interesting to be doing this on today's platform because one, obviously vaccines are the hot topic, and secondly, I think it's really nice to be doing this with Raches as we went to college together. So, well, hopefully at the end of the session, all your questions regarding vaccines will have answers to them. First of all, I would like to congratulate Team Bharat Biotech as well as Raches for coming up with the first indigenous vaccine of India. And like it was mentioned earlier, it's extremely proud. It's an extremely proud moment for us as a nation. And hopefully the future holds better for us. So Raches, to begin with, the big word for today is obviously vaccines, and it is the hot topic of debate. So going back to 2020, around February when this all started in India, it obviously started much before that in China and other parts of the world. Suddenly all eyes were on you, and there was a lot of media speculation, some good, some bad, but through it all, there was a dignified silence and your work finally spoke. And having had conversations with you, I also heard, the logistical issues that you had, even while transferring viral samples from Pune because of the lockdowns and curfew, which was a major challenge for you, and you had to send your team by road to pick up the viral sample. So when you and your team heard about this, what exactly went on in your mind? When was the inception of Covaxin? What challenges did you have to face behind the science as well as logistics, especially with the curfews, lockdowns, and everything was haywire at that point of time? So Do you want to give us a brief journey?
Sure, absolutely, Pragnya. So, when the pandemic hit in January, when this virus was detected in Wuhan and the genetic sequence was put out on the public domain, we started working quite in a rapid fashion. We were able to license two technologies from University of Wisconsin and the Thomas Jefferson University. These are two academic universities based in the States for two different kinds of COVID vaccines. One was an intranasal and one was an injectable vaccine. And then when the pandemic started to creep its way back into India, and when Prime Minister Modi announced a Janta curfew, which was Sunday, that was the first and only day of a lockdown for us. From Monday onwards, it was back to work, back at the factory. We don't have a corporate office. So life every day revolved at our Genome Valley campus, which is in Shamirpet, Hyderabad. As mentioned to you before, we started working on these two vaccine candidates with American academia. However, due to the lockdown, international lockdowns, it was extremely hard to ship things from the US to India. So then our chairman, Dr. Pragnya Ella, had an idea to work on another kind of vaccine. So a third kind of vaccine candidate, which is called an inactivated vaccine. So this has been around for several decades. It's a conventionally safe vaccine. The only concern one would have is how good of an immune response does it generate? How efficacious will it be? But from regards to a safety standpoint, inactivated vaccines are always considered to be safe. So Dr. Ella, chairman, had initial discussions with the Director General at ICMR, Dr. Balram Bhargav. You probably see him on these news conferences every day, along with Dr. Paul and other dignitaries from the Ministry of Health. He had a conversation with Dr. Bhargav to import the strain. So this is when I say strain, I'm talking about the actual COVID-19 virus. So this virus was actually detected and stored in a lab in Pune called the National Institute of Virology, which is again government run. So thereby we had an agreement with the ICMR, the Indian Council of Medical Research, and this lab called NIV Pune. We had a tripartite agreement where we could get that virus shipped over from Pune to Hyderabad. And when I say shipped over, this is actually Sunday was Janta curfew. Monday, two of my daring colleagues, in the midst of a national pandemic, in the midst of a national lockdown, drove down to Pune, picked up the virus in their car and brought it back. That's how daring this attempt was. There were no fancy logistics companies or DHLs or FedEx to do this work for us. We had to do it ourselves. And I applaud my colleagues who made that effort to go to Pune and pick it up. And as soon as we got the virus to Hyderabad, then everything was more or less clockwork. As Ms. Chigurupati rightfully mentioned, we have an array of vaccines at Bharat Biotech. We manufacture 16 different kinds of vaccines. Many of them are based on this inactivated vaccine platform. Approximately 5 are. And you've probably taken some of these inactivated vaccines. Probably to your children, you would have given them an injectable polio vaccine, or you probably take an annual influenza vaccine for the elderly people at your house. So this inactivated vaccine was not new to us. Once we got the virus, it was more or less, we kind of knew the methodology, what facilities we could deploy towards this, and what kind of raw materials we needed. So in that way, we were very much streamlined. We were able to organize our raw materials also, which is a hot topic these days, and also the supply of glass vials as well, which we were able to foresee that there could be a shortage of glass vials because there's many manufacturers making vaccines. So there's a whole list of materials that one needs to foresee before starting a project like this. And please note, this is all assuming that this vaccine is going to work. For those of you who are not part of the vaccine field, the probability of success that a vaccine will come into the market from the stage of discovery to the stage of it being licensed and available in a hospital near you, the probability of success is 6%. That's why there are so few vaccine manufacturers. Your risk appetite needs to be extraordinarily high, and the developmental process is extraordinarily long. So we were able to foresee many of these risks, mostly in part of good collaboration with the ICMR and also our expertise.
The more you explain, the more I'm convinced that it only takes an experienced company like Bharat Biotech to foresee all these circumstances and go ahead with what you did. My question is that, you said you had 6% success rate, right? So what kept you motivated throughout?
Oh, it was quite simple. I mean, the frontline healthcare workers were battling it out in the hospitals. Luckily, I have a white collar job. I sit in front of a laptop and conduct meetings in conference rooms. But my colleagues in manufacturing, in fact, we have 2,000 colleagues, 2,000 employees in this Hyderabad facility. 70% of them are manufacturing. So that is our entire workforce. So they are the ones actually in the lab, and they are the ones growing the virus. When you make an inactivated vaccine, essentially what you do is you have these large, we call them bioreactors. They're like fermentation tanks. If you've probably gone to a microbrewery which manufactures beer, you would have seen these large steel tanks. So it's something like that, but in a highly contained biosafety level 3 manufacturing facility where my employees are completely decked with protective equipment. They have oxygen cylinders behind them so that they don't breathe the ambient air. They breathe the air coming out of the purifier. So those are the colleagues of mine who are actually the most daring. And we inspired confidence from them and the frontline workers. And of course, it was a matter of national importance. And after studying for so long and working so hard in this field, this is our true calling. So we were happy and fortunate to be a part of this journey.
It's not only the frontline workers that should be applauded today. It's people like, the guys in your manufacturing units that actually have to be as well.